Bago po magtapos sa Oktubre, plano ng palawigin ng pamahalaan sa iba pang mga lugar sa bansa ang pagbabakuna sa mga edad 15 hanggang 17 na may comorbidity. Bukod pa dyan ay plano na rin pagbibigay ng third dose ng bakuna sa healthcare workers at mga nasa vulnerable sector. Kaugnay niyan, alamin natin ang mga rekomendasyon at reaksyon ng World Health Organization kasama si Dr. Rabi Abingasinghe, WHO representative to the Philippines. Good morning, Dr. Rabi. Dr. Rabi, good morning. Can you hear me?
Okay.
Good morning, Dr. Rabi. Dr. Rabi, may we get your initial assessment on the pediatric vaccination done here in Metro Manila so far?
Thank you for the question. It's an important question because the WHO recommends prioritizing adolescents age 12 and above with comorbidities to receive vaccines as the same priority as other priority groups such as A2 and A3 groups. So it's important that the Philippines has adopted a policy to vaccinate the adolescent with comorbidities, and CHO is very supportive of this. Initial vaccination rounds in NCR, I understand, have gone well with minimum side effects. So we encourage adolescents age 12 and above who are having comorbid conditions and their guardians, parents, to make sure that all of those adolescents access vaccines early. Thank you.
Dr. Rabi, do you agree that it's a high time to roll out the pediatric vaccination outside Metro Manila as scheduled on Friday, October 29?
For the comorbid groups, yes, we do agree. But we also continue to urge that increased availability of vaccine in the country means that need to start rolling out vaccines to the larger population, the adults. But also we need to be very conscious of the equity issues. WHO has raised previously several times its concern that we do not see equity. We see an inequitable situation with regards to access to vaccines in the provinces and in the regions outside of NCR and the major cities, especially for the most vulnerable, the A2 and A3 groups, where coverage ranges from about 30 to 40% in many of the regions and provinces. So with increased availability of vaccines, we continue to urge the local government units in those regions to make sure that as they roll out vaccines, they ensure a prioritization is also followed so that those most vulnerable groups are vaccinated. This is critically important because we still believe that we need to be very careful with dealing with the ongoing Delta experienced in some of the regions. And like we prioritize vaccination of those priority groups in NCR, we need to do that in those regions that are continuing to see increased number of cases if we are to save more lives. So our strong recommendation at local government units will continue to prioritize and vaccinate those groups, and the regions and provinces will ensure that there's adequate vaccine stocks to vaccinate the elderly and the comorbid populations, simultaneously while vaccinating the other groups, recognizing the availability of large stocks of vaccines in the country. But what is critically important is if we are to stop the hospitals filling up, if we are to stop the deaths, we need to ensure that elderly and comorbid populations are fully vaccinated. Thank you.
Dr. Rabi, are there really proven studies that older children are more prone to contracting the COVID-19 virus than the younger ones? As we know, currently we are only inoculating immunocompromised 15 to 17 years old, while the face-to-face classes will resume with only third graders and below.
The issue actually is that we don't have a bill for the use of vaccines in under 12-year-old children as yet. So in that situation, we need to continue to ensure that the adults, the priority groups are vaccinated, and that the children, as they start going out, continue to follow the minimum public health standards. That means avoiding crowded, closed settings like malls, dining areas, and ensure that they have access to by going out in open spaces, because we recognize that the pandemic and the movement limitations have had significant impact on their normal ability to grow up. So we need to address this immediately, and the way to do that is in the absence of recommendations for use of vaccines in kids, in children, we need to ensure that everybody else is vaccinated to create a safe environment, because these children could be a source of infection, although they could take the virus to the elders and the adults. So we need to ensure that the adults and the elders are fully protected. And then the kids need to follow the protocols that we have been advocating, in the sense of trying to maintain physical distancing, spending more time in open spaces so that they are less exposed to the risk of infection. We know that when kids get infected, the large majority of them have mild infections. So it's something that 20 months of the pandemic has demonstrated, and we are now more confident that they can go out so long as the adults and the elders are fully vaccinated.
Dr. Brabi, is the WHO still set to release its final recommendation on the third dose by November, and how likely will the WHO follow the said recommendation?
Well, we already have a recommendation on third dose for particular vaccine brands. We have a recommendation for a third dose for immunocompromised people, where we recognize that they are not capable of developing and sustaining the level of immunity that will protect them from severe disease and death. So we have said that our position is now that a third dose may be provided to more immunocompromised people if they have finished their 2 doses. And then we've also recommended a third dose for elderly above 60 years who received either Sinovac or Sinopharm vaccines. Now, in this allocation of third dose, we continue to urge that priority should be given to offer first and second dose to people who have not had access to vaccines. And then we start the third dose administration with the most elderly. So in other words, our recommendation is we start with the most severely immunocompromised. We start with the over 80s, then move to the over 70s, and finally to the over 60s. So this is what our position is now, so that we maximize the benefit of the third dose in those groups who will be receiving third dose. But again, the priority is to provide the first and second doses to those who have not been able to get a single shot, which is about 3 million people, unfortunately, still in the Philippines among the elderly.
Dr. Rabi, I'll read some questions from our media partners. From Lay Alvis of GMA News on booster doses. Should health workers and senior citizens already be given third doses or booster doses? What does the evidence say?
So I like to clarify that what we are recommending is a third dose and not a booster dose. There is a difference in the scientific terminology, and we are saying a third dose for immunocompromised or elderly people who've received Sinovac and Sinopharm, everybody who received the other UL listed vaccines. That is our current position. We continue to look at the global data on the protective efficacy of the vaccines. Vaccines still remain relatively very effective in preventing severe disease and death if you had the 2 doses. But in these groups of immunocompromised and the elderly who've received Sinovac and Sinopharm, they appear to require a third dose as an extended primary course. This is different from a booster. When we are talking boosters, we are talking of boosting the immunity in a general form. This is not what WHO is at this point. point of time. We will review the available data and make recommendations in November when the SAGE meets in the review of the global data. Right now, we have no recommendation on a booster dose.
But Dr. Rabi, is it possible to get a booster shot after receiving a third dose? Is it more urgent to roll out the third dose instead of the booster shot?
Sorry, I didn't. Your voice is breaking up. Can you repeat the question?
Yes, Doctor. Is it possible to get a booster shot after receiving a third dose? Is it more urgent to roll out the third dose instead of the booster shot, Dr. Rabi?
Definitely is more urgent that we give the third dose. But even the third dose, our priority is to provide vaccines to those who no doses at all. And then if vaccines are available, to those groups that I already mentioned.
Ideally, should everyone get a third dose, or is it only for the immunocompromised and the vulnerable people, Dr. Rabi?
It's only for the immunocompromised at this time. Guidelines may change meeting in November, but now we are not advocating third dose for the population.
Dr. Rabi, there is another development on the Delta variant as UK experts are recently investigating a so-called Delta subvariant. What do we know so far about this Delta subvariant?
Thank you. That's a very important question. We are talking of the so-called AY2 variant, which has been confirmed by Public Health England. We are looking very closely at this. Right now, this is not classified as a variant of interest or a variant under variant of concern. So WHO continues to monitor the spread of this particular new variant that has been detected. We are working with the public health authorities in the UK and other countries that have confirmed its existence. We want to understand whether it poses a particular risk more than the Delta variant in terms of transmissibility, in terms of the disease it causes and its response to vaccines. And the interim, this has not yet been classified as a variant of interest or a variant of concern, but we are following it up at this point of time. More evidence, we will share that with the Philippines and other countries. I also want to add that the Philippines is also monitoring variants, and this particular variant has not yet been confirmed in the Philippines. So we continue to work not only with those countries that have confirmed it, but we are also checking the presence of this variant even here in the Philippines, and that has not as yet been confirmed. Thank you.
Rabi, should we be alarmed here in the Philippines considering that the alert level system has already been implemented to more places outside Metro Manila?
I think we shouldn't be alarmed. We should be actually looking at how we can make the alert level system more functional, more effective, because the alert level system was brought in to bring back economic activity. This is something that we need to do, and the more effectively we do it, we can move and accelerate the economic recovery. So it is very important that we take a calibrated approach. We don't relax everything at once. We identify which sectors of the economy will benefit most by the measures we are taking and bring back those sectors in a very careful manner. And that's where the alert levels will be very important. The shift would be towards local governments taking ownership of what's happening in their areas, that they can stop transmission if there is an increase in transmission in local areas. This is why the alert levels are important. We are moving away from broad lockdowns to managing the pandemic at a very local level. And so this is a measure we encourage the Philippines and other countries to do. But for that, we need to strengthen our processes on preparedness response at the government levels so that it can be effective. If it's not effective, we will have to look at a scenario where we have to go back into big lockdowns. And that is why we are urging that we vaccinate the elderly and the comorbids as early as possible and strengthen our system so that the alert levels can be implemented at micro level, reducing the economic impact to the country.
We have another media question, Dr. Rabi, from Evelyn Quiroz of Filipino Mirror. Do you agree with the recent downgrade to alert level 3 amid the decreasing number of coronavirus disease or COVID-19 cases?
I would use a different term. I wouldn't say a decrease to alert level 3. It's a calibration to alert level 3, looking at how we can open up more sectors of the economy. But it needs to be also together with the implementation of the minimum health standards and also with increasing vaccination coverage. And in the case of NCR, we believe that with 90% or more of the population accessing the one dose and over 80% two of the eligible population, we are in a position to take this calibrated approach. This is not a relaxation. We are calibrating and seeing how we can open up the economy more. It's not about going back to what things were before the pandemic, because we continue to recognize that the virus is still circulating. I believe last week we saw a decline of the positive cases in NCR, averaging more than 1,000 cases. So that means there are a lot of people infected out there, and we need to follow the minimum public health standards as we carefully open up sectors of the economy. Thank you.
Dr. Ravi, from Tina Panganiban Perez of GMA News, Filipinos may already be planning reunions or trick-or-treats for All Souls Day, Christmas and New Year. Is it advisable to have these get-togethers already? And what can people do to avoid getting hit by COVID during this get-together?
Well, in the first place, we need to continue to follow the minimum public health standards during get-togethers, and the IATF has recommended that get-togethers be limited to the immediate family. Now, we do recognize that it's 2 years and people want to get together. Overseas Filipinos want for Christmas, and so our position would be that we advocate for anybody wanting to travel back to the country to complete their vaccination courses before they come. This will provide better protection. On the other hand, it's also important that family members, seniors, expecting travelers or expecting to have reunions are also fully vaccinated. This will minimize the risk of another big surge following the vacation.
Dr. Rabi, thank you so much for joining us today. Dr. Rabi Abeng-Yasihe from the World Health Organization. Keep safe, sir.
Thank you so much, Secretary. Pleasure to be with you.